We run a screening program through the schools, the daycares, the kindies. So we make sure that we're doing an ear health screen for hearing and ear health related issues with children. Our aim is to ensure that every child has the ability to hear and learn at school. Once identified, a child needs to have hearing services or ear health related problems addressed. We then put them into our clinical programs. So they come in by way of referral from the screening team at school, and they are seen by an audiologist and an ENT specialist.
We fly up 6 times a year to complement the team. With me there's a nurse practitioner, a GP, a specialist anaesthetist and a specialist ear, nose and throat specialist as well. And we work very closely with the communities up in the Pilbara. So we go in and carry out screening, which helps to identify any issues. I'll next go in and do audiological assessments, and from there we can refer children on for any speech assessment if needed, through to our GPs or nurse practitioners, and then on through to our specialist ear, nose and throat and anaesthetists if needed. And for some people they may actually need to go the whole way through into surgery, which we can also provide up there in the Pilbara too.
Early intervention for any child is essential, but particularly a child with a hearing loss, whether it be permanent or intermittent, which is the case for the kids with middle ear issues. Language is the foundation for all learning, so without those well-developed language skills, we are making it more difficult for them to succeed at school. And speech and language is also the foundation for literacy, so learning how to read and spell and write. By getting in early and getting those skills strengthened when they're most ready to learn, we are setting them up for a greater chance of success at school.
I personally have a deaf son myself, so I've had to live the hearing and deafness life since he was 5 years old, and he's now 28. So for myself, I'm really passionate about ensuring that all children have really good hearing and the ability to learn at school. So for me, it's just really integral, because they're not going to learn if they can't hear. It's really satisfying for us as a team to see children you've identified there's a problem in the 0 to 4 age group, and then seeing them go off to high school, they're well adjusted, they've been attending school and they've actually got their learning outcomes out of it. So yes, I think without it, it'd be a really sad situation still.